Hey there, I'm Dr. Jennifer McGowan, pelvic physical therapist and owner of Regenerate Physiotherapy here south of Atlanta in Georgia. And today I have an amazing guest that I refer often to who also lives in the town near us in Peachtree City, Georgia. This is Dr. Erinn Harris. She is board certified internal medicine physician with specialty training in functional medicine. She graduated from Earlham College with a bachelor's in art and biology and from Indiana University School of Medicine with her doctorate in medicine. She completed internal medicine training at Emory University and functional medicine training through the Institute of Functional Medicine. She enjoys baking and cooking and spending quality time with her family. She is also the owner of Harris Internal Medicine, which is here in Peachtree City, Georgia. And we'll get into more of how she ended up opening that practice and specializing in functional medicine. I'm also from Indiana, so we have that in common. But we're just going to
Sure.
jump right in. IU.
Yes.
I just say basketball. That's Indiana. So I'm going to jump right into some questions and wanted you to first see if you could share a bit about your background and what inspired you to not only enter medicine, but um, internal medicine and then functional medicine.
Thank you for having me, Jennifer. I really appreciate it, and I'm glad to be here with you this morning. So you must be really special because I'm not a morning person. So
I'm trying my best right now. Here we go. Thank you for giving me your morning.
alrighty. So what inspired me to go into medicine is really actually I did not have any idea that I would go into medicine. I was a junior in college, and I was really more interested in biochemistry. And I took a biology class and realized that I liked it more than biology, but I mean, I liked biology more than chemistry. But I still like the combination of both. And we'll get back to that in just a second. So I really started um, have more interest in biology, taking more courses in biology. And really, a professor came up to me and said, you would make a really good doctor. And so I kind of kept that in the back of my mind uh, and really kind of pursued microbiology for graduate school. Did some time in the lab and really realized that I really like bench science. So I applied to medical school, and the rest is history. Internal medicine sparked my interest in medical school because it was I would say, brain entertaining. There were so many we had differential diagnosis for everything. And then you had the fund of knowledge that you needed for internal medicine was so extensive. It wasn't, and I love surgery because it was, of course, procedural, but it was so, like extensive. The knowledge that you needed was just so extensive, and it could just be anything. It was like figuring out a puzzle. And so it could either be this, or it could be this, or it may be this. And so which one is it? And so that really intrigued me with internal medicine. So I decided to pursue my training in internal medicine. Eventually thought that I would like to do specialty medicine and nephrology because, again, I was going down that trail of more biochemical
Mhm.
um, rather than kind of like anatomical. That's
Mhm.
where my kind of lean was. Um, I I had to actually go back to Indiana University because I had a scholarship and they paid for my most of my medical education, and I had to serve in an underserved area. So I just continued to, practice primary care, but I think it was like 2017. While after I opened my practice in Tyrone, Georgia. I think it was in 2014 for with the direct primary care model. And I had patients that would come to me and say, you know what? I was really anxious and I took folic acid and it got better. And they would bring to me, have you ever heard of food intolerances or food allergy? I really think that's causing a lot of my problems and rashes. And I was like, no, but I was willing to look into it. I was real well, I wasn't willing to shut that down. I was willing to kind of look in to see if that was a thing or if that was actually the case. And so the more I looked into it, the more I kind of was opened up to the world of functional medicine. And then um, my husband brought up a video that a woman was taking copper supplementation and she actually started her vitiligo was improving. I've had vitiligo since I was 20. Vitiligo is an autoimmune disorder, which I was told as a physician, it's just going to continue to progress, just like all autoimmune disorders and get worse. And so you know, I started down the rabbit hole of functional medicine and really just grabbed a hold of it. And that was kind of like my entrance into it and met another physician who was practicing functional medicine at the time. And then that was it. I was a goner by that
Yeah.
time. So I really just intrigued because it really incorporated the things that I love the most about medicine, which is biochemistry and physiology. The whole process of how you get to disease and how disease breaks down and really what the normal function is on such a small level of the body, like the chemical and biological, but physiological and molecular level of the body. Intrigued me as that's how the body works. We're kind of stacked up. It starts off with chemical processes, goes to cells, tissues, organs. So if you can get it, if you get to the very bottom of it and fix the very bottom of your foundation of health or not or disease, then you can kind of fix everything else.
Yeah.
So that's how I got here.
Yeah, that's awesome. So, functional medicine as a pelvic physical therapist, a lot of us pick up on that because we are asking as pelvic physical therapists, bowel, bladder, reproductive health, menstrual health. And we see a lot of people that have pelvic floor muscle dysfunction going through transitions, so postpartum, prenatal, perimenopause, even men as well as they enter their 40s. And so often functional medicine are great places we like to refer to. But for those for the people who have not heard of what functional medicine is, do you mind explaining a little bit what functional medicine is so people know what it
Yes, of
is?
course. Yes. So the basis of functional medicine or the basic is we are getting to the root cause of your problem. So if you kind of look at a tree, a tree has fruit at the top, and of course you have branches in the trunk of the tree, but then you have the root. The root is where all the magic happens. The root is where you get your nutrients. The root is where you get your water. The root is what keeps the tree alive. But whatever, if the tree is diseased, it's going to start at the root first, and it's going to show in the fruit. And so the fruit is, whatever symptom you have or whatever disease that you have. So the fruit can be gastrointestinal dysfunction or diarrhea or prolonged menstrual cycles, or it could be abdominal pain or rashes. But actually, the root cause may be something totally different, like a toxin or genetic dysfunction or your microbiome being disturbed, which is the bacteria in your stomach being disturbed, or it could be a food intolerance. And so what we get to is the why of what's of the fruit. So what is actually the dysfunction that's going on? What's the root cause of the dysfunction that is affecting this symptom? And so instead of treating symptoms, we treat the root cause.
Yeah. Yeah. And I think what would be helpful too is explain because I when I'm working with clients in the clinic, they have that desire to have that with their primary care doctor. So I guess explaining what is it like to have a initial evaluation with you as a functional medicine physician, who, by the way, I'm going to make sure to write that question down. I would like for you to explain a little bit more of that process. So when people are, maybe there's people locally listening to this, or if there's somewhere else in the country looking for a functional medicine doctor, but I'll have you explain your training more for that. But also, first, before is what does a first session look like with you or the evaluation versus where you were practicing even prior to DPC? Because DPC, I think you're able to give people more time. But if you could explain that, that would be helpful.
Yeah, so when I was in fee for service or not, the direct primary care model where I wasn't able to give a lot of people more time, I would come in, I would look at their problems, I would go down their problem list, and I would say, blood pressure okay? Good. How's your blood sugars been running? Great. Okay. If your blood sugars have been high, oh, it seems like this has been high. I'm going to increase your medication. And your blood pressure has been high, I'm going to increase the dose of your medication. Or you have a rash, I'm just going to give you a steroid cream. Even then, when I was practicing then, I was thinking there has to be more to this than just finding a drug, getting a new drug, and treating and giving this person a drug. Drugs are helpful when it's appropriate, but it's not to manage chronic disease. And so the difference of when I practice is in my first session is 2 hours,
Mm-hmm.
uh, and prior to you coming into the session, you have a significant amount of paperwork to fill out, not about your payers or insurance or, any of that. It's about how did this all start? It's an extensive history, basically,
Yeah.
of from the time you were born, your family, what you were exposed to, what is your, a food diary, a 7-day food diary, what do you eat in the morning, noon, and night? Um, did you have any accidents? Did you have any surgeries? Did you an extensive symptom review? And so it helps me put all of the pieces together even before they come into the office. But still, even when they do that, we still have an extensive history to take. You know, what is your major issue and when did this start and how does this affect? And we do a timeline from the time you were born up until your current age. And we also do kind of an extensive, we call it the matrix of all of your significant symptoms and really see how they fit together. So,
Yeah. 2 hours. That's a long time. And I think
yeah,
even if, so gauging myself, I'm in my 40s, but I just my whole life seeing my primary care doctor at the initial visit, sometimes I'd get 20 minutes, sometimes 15. And then as every year's gone by, I'm like, now I get 5. And I remember just listening to providers tell me personally, like, if there's lifestyle stuff they want to discuss too, it'd be like a list of 20 things. And they're like, it's overwhelming. And you're like, I don't know what to do. So that 2 hours, I guess that goes hand in hand with you getting to the root cause when you're going all the way down to the time maybe were you vaginally born or cesarean and then
yes,
the immune system. And I think
yes,
that's really helpful because I think people are looking for long lasting change and they don't want to take medicines any
yes,
longer.
exactly.
So I think also functional medicine has become a catchphrase where
Yes,
people will take a course and say they're functional
right.
medicine when they've not necessarily gone through the course like you have. Can you explain a little bit more about your training in functional medicine?
Yes, yes, I can. Extensive is what I can say. And the reason why I can say that is because before I started functional medicine training and functional medicine doctors would talk to me, I was like, did we really learn this in medical school? Was this really for training? I just don't remember any of this. And they would speak to me, and I really felt like they were speaking Japanese. It was almost like going to medical school again. So when I started medical school, we had all of these phrases and all of these kind of Greek names for all of these medical terms. And I was like, it's like speaking a new language. And that's exactly the way I felt. when I started functional medicine again. It was really, I was like, oh my gosh, I learned all of this in medical school during my first 2 years, but it was for a test. And if anybody will tell you, your first 2 years of medical school are the hardest years for you. But I just learned it for a test and forgot it. But it was really not just learning what we learned, but actually putting it to use and actually using that, um, all the biochemistry that we learn in medical school, all of the physiology that we learn in medical school. So the functional medicine training is a 2-year training. If you do it, like you can, if you actually do the whole track, in which I did, I took a course. I think it was offered every quarter, and it takes about 2 years for you to do that. So it's a I would take the two courses together as to is it six additional courses in each area. So you'll take a cardiovascular course, an immunology and allergy course, a toxin load, like what we call a biotransformation elimination course, gastroenterology, hormones, and energy, which is, mitochondrial dysfunction. You take those courses, and then you actually have to do a case study, which is took about, I would say, a month for me to complete because it is very significant. So you have to pass a case study on a patient, and then you have to take an exam. So it's a board exam, just like any other board exam that I've
Yeah.
taken in my lifetime for internal medicine. I've sat for a board exam. And the exam was about 4 hours long. It was difficult.
Mhm.
And, and yeah, so, and we, just like any other board exam, we have to recertify every 10 years. So it no, just because you're a doctor doesn't mean you can walk on and start doing functional medicine. You may do it. They have some kind of foundational courses, but you're really, the information that you learn when you're certified is much more than what you just kind of get in a baseline course.
That's really helpful, I think, as people are learning more about, I think I need a functional medicine doctor. And it's also that time that you get with a functional medicine doctor that's helpful, but just Googling and I always say just research the provider you're maybe wanting to see or someone refers, because there's board certified functional and then there's the other things where people are just kind of throwing the term around.
Right.
Um, which, yeah, I just wanted you to explain the difference so people know a little bit about your background. Um, I think kind of switching more into to get to know you a little bit better. I'd like for you to talk a little bit about Harris Internal Medicine, when you started or transitioned that into, I think you said Tyrone 2014, but was that the name of your practice? And then all the services you offer with your practice.
Yeah. So I the kind of backstories that I burnt out in fee for service around 2012. I went to the VA to kind of practice to see if it was any better, and I realized it wasn't. Anybody remembers Snowmageddon in Atlanta around 2014, January of 2014, I had a kind of life changes where my sister had been
Mhm.
diagnosed with breast cancer, and a friend had been diagnosed with breast cancer. Really had to see, okay, is this really what I want to do for the rest of my life? And so Snowmageddon gave me an opportunity to really focus on what I really wanted to do. Found direct primary care, which is a model that allows you to spend more time with your patients. Um, you don't contract with insurance companies, but you contract with your patients in order to pay for office services. And so, really, the concept was really new in 2014, and so I looked into it. And then in April of 2014, um, I opened the business, which was crazy because I had zero patients. So yeah, I opened in Tyrone, and then eventually moved to Peachtree City in 2019. in the same building where I am now. Um, so Harris Internal Medicine really started off as primary care and then transitioned into functional medicine. So I still did not want to give up the practice of internal medicine or primary care. I still love, taking off skin tags and doing skin biopsies and making sure people have their pap smear. So I just decided when I bring on a patient as a functional medicine patient that I practice both. So I am your primary care doctor just in case you get a sinus infection, which can be sometimes functional medicine can treat, but sometimes it can't.
Mhm.
And sometimes you just need a primary care doctor. So uh, I have combined the two, and I've actually hired a nurse practitioner to take care of more urgent needs or less complicated patients. I'm in the process of hiring another functional medicine doctor. So if there's one out there that wants to come to Peachtree City, Georgia to practice with me, please
Yeah.
call me because we're really busy and I really need another doctor. Um, and so that's basically what we offer. We offer functional medicine, but we also have transitioned to have a wellness side where we do exosome injections and IV therapy, and we also do treat vaginal dryness and actually erectile dysfunction now. So that's what we offer. And shockwave therapy for joint pain and PRP, like exosome and PRP injections for joint pain, because there's sometimes people have done the damage and they just kind of need help, even though functional medicine can help. Sometimes the damage has been done as a result of inflammation and they just need more help. So we've kind of added that on.
That's great.
Yeah.
So going back to like DPC, you touched on it a little bit, direct primary care. How, again, when did that come about, and how does that work as you mentioned patients contract with you versus insurance companies. So tell me, is like a membership type of a thing, or does it depend?
Yeah, it is a membership. So, um, what we saw happening and what we continue to see happening is insurance prices and are just astronomical. But just because you have insurance doesn't mean that you have good care. So, insurance doesn't equal great insurance doesn't equal great medical care. And so we decided as a result to take the middleman out of the equation, which is insurance companies, and just directly contract with the patient. And so that gave us less overhead, need for less overhead because we weren't um, paying someone else to try to get paid by insurance companies. We were just directly contracting with our patients. So it's a monthly membership, usually pretty reasonable. Between most practices charge between $45 and $100 a month. For functional medicine, for primary care, for functional medicine, I charge between 250 and 350 per month, depending if you have a health coach or not. And so really reasonable, not astronomical, pricing, and it really gives us more time with our patients. You get more access to your patients. We have secure messaging during after hours. You can, usually get in next day. You're not waiting forever to get in for an urgent appointment. I'm not
Yeah.
saying for me, and even for me, it used to be that you could get in for a return appointment the next day, but that's why I need another doctor.
But still, I think as we're aging, obviously when we get 40s, things just start changing. But
Yes,
can start anywhere in your life. But we're just looking out at emergency rooms and urgent cares being bombarded. And so having the access to you, if you get a UTI, that really is a significant one, being able to get into you within 24 hours or message you and say, hey, you're cutting so much cost. Is that urgent care cost? If you're looking at that cost, is going to run you at least $200 for about 10 minutes with the provider, with
right.
someone that you don't really know, who doesn't know
Exactly.
your history. So, um, So I think I love GPC from a cost savings for our family because we do it for our children. I do it for myself. Just because we have a high deductible plan, we've opted to do that because you just said even if you have great insurance doesn't mean you get great health care. And I know that that's a good, an expectation and it would make sense, but definitely for people listening, if you don't know what your benefits are, look into them because some people just they're not sure because they've been pretty healthy, but
Yeah,
also like meeting with you and working with you through the time, you're just going to know, okay, we've tried this medicine or this route, or maybe Lyme disease, and so just having someone there that's consistent, I think is also really helpful. So you're not trying the same thing over and over.
yeah.
Um,
And a
I
lot of times
think,
they don't even need to come into the office. They can, if
no,
you have a urinary tract infection, oh, you have it. Okay. Well, we'll give you something over the phone. And if you need to come in, if it doesn't get any better, then you can come in. So,
yeah,
yeah.
time, virtual.
Yes.
Yeah. So that being said, I think I could go on and on about functional medicine. But if someone is in this, like, where are you treating? Is it just south of Atlanta? Do you help people throughout the state of Georgia? Um, where
Yeah,
can someone come see you?
yeah, actually, I have people that come see me. I have a person from New York actually that comes to see me. As long as you can see me once a year, you really can't see me from anywhere. I can't like just see you in another state if you don't at least see me once a year. But I can do virtual in another state. But for the most part, anywhere, I have patients all over Georgia that
Yeah,
see me.
yeah.
So,
So Atlanta, south of here. So that's
mhm.
that's great, especially with the virtual option because sometimes the physical exam is necessary and sometimes not.
Yeah.
Um, so I guess I wanted to kind of switch gears and wrap up here in a second, but if there was one piece of advice you could give a person in their health journey or health and wellness journey, what would that be?
I think the one piece of advice I could give someone is listen to their gut and listen to, I guess you would call their inner voice. Because a lot of times people will think they will be in despair and feel that what they've been told is actually the truth. And just really, if you look for the truth will find you. And so I tell people to look for and you know, seek out truth as far as their health goes. Don't take no, this is, the typical like, well, because some people will just say, or some physicians or other people will say, well, that isn't possible just because of lack of knowledge. And they don't realize that there's another possibility out there. And so I would say to them, don't take no or answer if your inner voice or your gut is saying there's another option. There has to be something out there. If you are in your heart saying, I know there's something else out there for me to help me, then seek that and it'll find you.
That's great. I love
Yeah.
that. That's I hear that story a lot when people come into like I was told this for 10 years, but
Yes.
keep searching.
Yes.
Um, so, for people listening in, what's the best way to find you and book with you, get more information?
Yeah, the best way to find me will be most likely it's my website is www.harrisinternalmed.com. You can also find me on Instagram is Erinn Harris MD on Instagram, or you can call the office at 770-954-5010.
And I'll have that all in like the description below here so that you can find the link. And then I might even put where you got your training from, the Institute
Yes,
of Functional Medicine, so people can maybe learn a little bit more about that.
right.
But thank you so much for your time. I really appreciate it.
All right. Thank you for having me.